on, push the button!
Yeah, come on, push a button!
Push the goddamn button!
Push the goddamn button!
How can I help you?
Hi, this is Nicole. I called earlier regarding rain.
Okay, yes, ma'am. Let me put you on a brief hold and let me see if the veterinarians had a chance to review that record, okay?
Okay, thank you.
Williams will be with you in just a minute, okay?
Okay, thank you.
And are truly appreciative for all feedback we receive.
Hi, so I just got a chance to look through Dr. Rankin's notes. You know, I have not seen Rain, but kind of reading through Dr. Rankin's notes, she made really excellent notes in terms of kind of everything that was going on and everything that, you know, has been happening with Rain. Sounds like you started the warm compresses on that kind of swollen, leaking teat, and at that point noted that the kind of discharge is increasing, still more kind of milky, and then a little bit of kind of some bloodiness at the end. Is that correct?
Correct.
Okay, good to know. And as far as things go, does she seem more, I guess, uncomfortable when you are doing that, or does she tolerate it pretty nicely?
No, she's happy, her tail's wagging, and she's just relaxed.
Absolutely. Okay, good to know. Glad to hear that she seems to be doing well. She's still eating, drinking, seeming good in all those regards?
Yes, and no diarrhea.
Good. Very glad to hear that. So as far as things go, you know, one of the things that we can see when doing the warm compresses on those kind of swollen or blocked teats or milk ducts there is sometimes we can see, you know, as the warm compresses, what that's doing is kind of essentially relaxing everything in the area and allowing drainage. And sometimes we can see a little bit of kind of reddish discharge or some kind of bloody discharge if she did have this swelling going on for a little while, to the point where it was, you know, causing her some inflammation, causing a little bit of discomfort there. I was reading through Dr. Rankin's notes, and thankfully she had not seen any like white blood cells in that discharge when she was first in, so no concerns about like, you know, a big old abscess or something. But it does sound like, you know, I am very pleased to hear that it seems like Rain is a little bit more comfortable, as well as that discharge or that swelling is kind of decreasing or going down. I think probably what I would recommend at this point, based on the history and kind of what it sounds like is going on with Rain, I'd probably still have you continue with the more warm, moist compress here for another day or so. And then maybe even switching over to kind of like a colder compress to try and decrease some of that inflammation. But at this point, based on what I'm hearing, you know, the fact that she's still eating and seeming happier, I don't know that I'd necessarily start an antibiotic for her at this point. I will say, you know, if we notice that even going through till tomorrow, seems like that redness is kind of getting more and more in volume, if she starts seeming like she's uncomfortable, if that teeth feels like it's getting kind of hot or swollen again, definitely call us back. I'll be here. I'll be the doctor on tomorrow morning as well. So if something should happen then, I'll still be here and I'll make notes on what we chatted about. But it does sound like actually Rain is kind of progressing in the correct direction with those warm compresses.
Come on, push the button!
Yeah, come on, push your button.
Push the goddamn button!
Push the goddamn